Now, joining us to discuss this further is Ntandokazi Capa, who is the Eastern Cape Health MEC. MEC Capa, thank you so much for joining us this afternoon on Newsfeed PM. I guess to just jump straight into it, these are alarming statistics that have been released by the department as well. When one considers the various NGOs and government initiatives that have been put in place, is it safe to say that they are failing, they're not working?
I don't think it is fair to say that, because we have seen a number of increase as the department in the last 2 financial years. So it means there's progress in what we are doing. We just need to put more energy into it. We need to expand it. We need to make sure that we involve other stakeholders, because as Eastern Cape, we do have partnership with various NGOs, as well as in partnership with Department of Social Development, Department of Education.
At this point, though, would you admit that there is seemingly a problem? If we're talking about 10 to 14-year-olds, just under 100 of them who have fallen pregnant via this must be statutory rape.
Definitely, there is a problem. That is why yesterday we visited Zwelitsha Senior Secondary School. It's because we have identified that there is a problem, and it was identified by the department, the Alfonso District Health Region, where they were able to identify that there is a problem in that school. So it is clear that there is a problem, and it needs everybody. It needs the community, it needs parents, it needs other partners to be part of this problem in trying to address it.
And, you know, earlier on as well, there was a report while you were also at the school as well with our reporters, and you had said there should be also a focus on the boys. Tell us more about this approach.
Good. Because we think it is important that we should not only focus on the girls, but must also focus on the boy child, because we also believe that it takes two to tango. And again, as the department, we have not done any research to actually understand who are the fathers for these teenage pregnancies. So it is important, therefore, that we must try in all angles to try and address it. But what is important is that we must not only focus on the girl child, we must also focus on the boy child, so that we are able to cap whatever that we are faced with as a department.
MEC, I'm quite interested to know more about what you're talking about, that research, to know more about who are these fathers. Are they school-going kids as well? Are they adults as well, members of the community? And when we're looking at that 10 to 14 group of those 94 young girls who were pregnant, do we know if there've been now 94 cases that have been opened at the SAPS? Do they correlate with the other departments as well to show that there is some sort of action being taken?
From the part of the department, we do not have that information. Remember, they become our responsibility when they are pregnant as the Department of Health, but we do not have that information. Hence, when I spoke yesterday, I said, we need to go back to that community. We need to do a thorough research so that we understand. One information that we received from the school was the fact that a number of children from that area are from the child-headed families. So it means there is no parenting at all.
Yeah, and this need as well, clearly it needs to happen pretty soon as well. Do you have any time frames that you've discussed? I know you were only there yesterday, but this has been a burning issue for many years now. Do you have any time frames as to when you can go back to this community and find out who are these fathers? And particularly in the case of the very young children from 10 to 14, where it does qualify as statutory rape, to be able to try and at least try and track those perpetrators?
Today, I met with the MEC for Education, and we agreed that we must meet, because it was really a concern for me, especially for that particular school. We agreed that we are going to meet. I do not have the actual time frames, because I do not want to commit something that I'm unable to meet. But there is a district that is continuously monitoring the process, and the department was not going in that area for the first time. It was going there for the third time, I guess, because remember, in that area, one thing that prompted us was the fact that during the election period, there was 3 weeks where the school was closed, and there was no access to services at all. in that area. So that is why we decided that let's go back there and see, because we are convinced that the 3 weeks that children were not doing anything has contributed. That is why you can see this number now rising.
Yeah. And also, you know, talking about going back with the Department of Education as well, any possibility of going back with community safety or the SAPS as well for those cases where they can be opened of statutory rape?
I think the proper procedure is for us, Department of Social Development, Education, and Health, to go there. Once we know what is really happening, then we can rope in to safety so that we are able to give a clear report. But now to just invite them, because remember, they go and investigate when there's a suspect of a case. But for now, let's give Department of Education, Social Development, Health. Once we know what is happening, then we are able to rope in the Department of Safety.
So, MEC, there's clearly a clear-cut plan here moving forward, and hopefully it does yield positive results here. But is there a message to those people who do then go and rape children, 10 to 15 years old and even beyond, but specifically for this 10 to 14 group as well, of those 94 girls, that actually they may not be able to get away with it any further moving forward?
Definitely, we are sending a clear message that they are not going to get away with it. That is why we are putting a focus on it. It is quite clear that in that area and in other areas in the Eastern Cape, there is a problem and it needs our attention. But we are warning those that are committing those serious crimes that we are going to deal with them, and we are going to deal with them very soon.
Yeah. Earlier we were speaking to Dr. Foster from the Masimenyane Women's Rights International, and she was talking about the role of uktwala. What factor does this have as well on teenage pregnancies?
I do not want to argue with the doctor, because from where I am seated, especially in that area, there is not one incidence of uktwala. Okay. In the school that I attended, there is not one incident of uktwala, but you've got about 27 kids that were pregnant in last year and 19 this year. And even yesterday when I was there, I was told that a day before, a 13-year-old fainted. And when they took the child to a clinic, they learned that she was 8 months pregnant. So I don't want to attribute that. It might be a contributing factor. In other areas, I do not know. But in that particular area, I do not want to say it is a contributing factor. Of course, there are quite a number of issues that can contribute to that. Remember, I said child-headed families, lack of knowledge, as well as the role that is supposed to be played by families and parents. Remember, I said earlier, parents are not really taking responsibility for their children. The others are not really keen to engage on these matters with their children. So that is also a contributing factor from where I'm standing.
Yeah. And let's expand on that, MEC, while you're talking about parents also having to play their part too. I mean, we know that sex is still pretty much a taboo in most African cultures as well, particularly. So what kind of a role does that play when you're speaking to parents as well? This sex being a taboo, are they becoming more open to having these kinds of frank discussions with their children, boys and girls?
Not at all. It is true. It is a fact. Sex is a taboo in our culture, especially in African communities. It's something that we need to deal with. Hence, when I was talking to the principal and talking to the district director, I said we need to organize committee meetings, engage those and explain to them that if we do not discuss this issue, our children are sexually active. It is upon us then to deal with this issue as now. Otherwise, it's going to continue like this, and it's really hampering on us as the Department of Health. Remember, once these children are pregnant, they become our responsibility, and their bodies are not ready to carry any pregnancy. As a result, they will have repercussions of such a pregnancy at an early age.
Well, MEC, those conversations are truly crucial indeed. Thank you so much for your time this afternoon.